Thanks for being with us here virtually today. I'm joined by Dr. Phil Chan. As most of you know by now, Dr. Chan is a consultant medical director at the Rhode Island Department of Health with us in our Division of Preparedness, Response, Infectious Disease, and Emergency Medical Services. I'm going to give some general COVID-19 updates, and then Dr. Chan is going to give an update on where things stand with our vaccination effort, and then we'll take some questions. Before I dive in, though, I want to address the elephant in the room with all of us. It's obviously that Governor Gina Raimondo has been nominated by President-elect Biden to serve as Commerce Secretary. It's an honor and an incredible opportunity, and I am thrilled for the governor and for our country. We all already know that we have an amazing, brilliant leader, and the country will be able to benefit from that as well as Rhode Island. I want the people of Rhode Island to know that our COVID response will not skip a beat. The governor continues to devote her time and energy to managing Rhode Island through this crisis. In fact, our teams have continued full speed ahead through today. And if you know the governor as I do, you'll know that she never takes her eye off the ball. I've also had a brief conversation with Lieutenant Governor McKee. I thanked him for the commitment he made to continuity in the COVID-19 response team. And I told him that I look forward to working with him, as does our entire COVID response team. So now I'm going to give an update on our COVID-19 response, and I'm happy to take questions on our response. To be clear, I will not be taking questions on the governor's nomination today. I'm sure she will be happy to answer your questions next week. So let's begin, as we always do, with data. Yesterday, we had 924 new cases out of 15,385 tests for a percent positive of 6%. Sadly, we also saw another 6 fatalities. I know we're all tired of wearing masks and social distancing, but this virus is still incredibly dangerous. When we look at the data, I think it's important that we all remember these aren't just statistics. Since our last press conference just 2 weeks ago, more than 232 Rhode Islanders with COVID have passed away. That's 232 mothers, daughters, fathers, sons, grandparents, neighbors, co-workers, and friends. While the severity of this virus hasn't changed, thankfully, our ability to fight it has changed. As of today, 31,541 doses have been administered in Rhode Island. 29,743 first doses have been administered, and 1,798 Rhode Islanders are fully vaccinated, meaning that they had received 2 doses of COVID-19 vaccine already. Dr. Chan is going to be able to share more as far as that. While we're working to quickly distribute vaccine to our high-risk populations, we all need to continue following the rules so we can save lives and prevent our hospitals from becoming overwhelmed. We've seen a bit of an uptick in our percent positive rate since the holidays, so it's especially critical that we all double down now. We know that over the holidays, people were more likely to gather with friends and family and less likely to wear masks. We don't yet have a full picture of the impact Christmas and New Year's had on the virus, but we are seeing so far, it's a bit of a mixed bag. Our percent positive rate has been higher than we'd like over the past week, but we had a good day yesterday. We've seen excellent compliance from businesses over the last 2 weeks. Thank you. Last week, the Department of Business Regulation performed more than 500 inspections and found almost perfect compliance with mask wearing, social distancing, and capacity requirements. Even on New Year's Eve, we had very few instances of businesses not following the rules. Again, I want to thank business owners for their cooperation and collaboration. I know these restrictions have been difficult, especially around the holidays. We're working hard to make it so that it was worth it and we can go forward effectively from here. Another encouraging piece of data is our hospitalizations. We've seen a nearly 25% decrease in both our daily new hospitalization admissions and weekly hospitalization averages over the last 4 weeks. Today, our daily average hospital admissions is 51. Just 4 weeks ago, we were seeing 66 new hospitalizations per day. 4 weeks ago, our weekly hospitalization average was 468. Today, it's 360. Now, let me be clear. Our hospitalizations are still far too high. It's a testament to how severe the situation is that having 51 new hospitalizations a day due to COVID-19 could be categorized as good news. But there's no question that this is a marked improvement from where we were a month ago. And it's a trend that we need to see continue, especially as a new, more contagious strain of COVID-19 is identified in our neighboring states. As far as us here in Rhode Island, we are monitoring for this new strain. While we have not yet identified it here in Rhode Island, I have every expectation that we eventually will. So while people are being vaccinated and we feel good about the future, we cannot take our foot off the gas in the short term. As a reminder, our current restrictions remain in place and we plan to stay the course until then. That said, if next week our data looks much worse, we will have to reassess. In the meanwhile, everyone can continue to do their part, wearing masks, watching your distance, washing your hands. All of these continue to be critical tools to moving us forward. Please do not let up on that. While much of our public focus has been on vaccines over the last several weeks, our team is hard at work improving our existing systems to fight this virus, particularly with testing and contact tracing. Today, I'm excited to announce a new technology update that will make our contact tracing process quicker and more efficient. Here's how it works. Typically, when you test positive for COVID, you get a call from one of our contact tracers. One of the first things they'll ask you is for a list of everyone you came in close contact with during your infectious period. Our contact tracers are great, but sometimes that process can take quite some time. People don't always answer their phones right away. They may need to search for a friend's cell phone number. For one reason or another, it's not always as quick as we'd like it to be. Once we get contact information from your contacts, then we go through and call all of them to tell them about their need to quarantine, stay at home and monitor for symptoms because they have been exposed to someone who has tested positive for COVID-19. Again, this doesn't always happen immediately. Sometimes there are several rounds of phone tag before we can really get started connecting with someone. You'll remember that a few months ago, we launched our results portal. The website for that is portal.ri.gov/results. So instead of waiting for a call from the Rhode Island Department of Health, you get a text message when your results are ready. But now, if you go to the portal to check your results and find out you're positive, you'll be asked to fill out an online form listing out your close contacts and their contact information. Those individuals will then get an automatic text message instructing them to quarantine. You can also indicate whether you need any supports like food or housing or cash assistance. Since we launched this system late last month, More than 600 Rhode Islanders have used our self-serve system to report their contacts. Because of that, we've been able to direct more than 1,200 Rhode Islanders into quarantine via a rapid, automatic text message. We estimate that this has already saved our team 1,200 hours of work, meaning we have more time to devote to complicated case investigations and contact tracings. As we've said before, every minute counts with this virus. The sooner we can get people into quarantine, the sooner we can slow the spread. From a treatment standpoint, the governor, Dr. Chan, and I have talked a lot about testing and a lot about vaccination. What we want to make clear that the third main thrust of our response right now is treatment. Rhode Island now has a doctor-recommended treatment for COVID-19 that is extremely effective at preventing people from developing severe disease and from being hospitalized because of COVID-19. The key, though, is starting early. The earlier you start at starting treatment after testing positive, the better and more effective this can be. After completing a simple infusion intravenously of this treatment, many people with COVID-19 start feeling better as early as the next day. The treatment does not require hospitalization, and it's intended to help prevent from actually having to be hospitalized. If you test positive for COVID-19 and are 65 years of age and older, or you have an underlying health condition, immediately call a healthcare provider and ask about treatment for COVID-19. You should start with your healthcare provider, and if you don't have a healthcare provider, you can always obtain one specifically for this treatment by going through telehealth services. Telecare by Brown Emergency Medicine is available for anyone who doesn't already have a provider but needs to access one so that you can have direct connection to this critical treatment. There's information online at www.brownemtelecare.org. brownemtelecare.org. If you don't have a healthcare provider and were tested at a state testing site, you can be evaluated for treatment options at one of several treatment centers throughout the state. You can find more information at covid.ri.gov/treatment. So remember, as we're expanding testing and you're getting tested, if you test positive and you qualify, access the treatment that's available. It makes a difference. The last topic that I want to talk about today is something called multisystem inflammatory syndrome in children, which you'll sometimes see called MIS-C. You may recall that I discussed MIS-C in June when Rhode Island had its first case. MIS-C is a condition where different body parts can become inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. MIS-C in itself is not contagious. However, many children who have had MIS-C had COVID-19 at one point. We have had additional cases of MIS-C in Rhode Island more recently. Specifically, between December 18th and December 26th, there were 6 children who were admitted to the hospital who were later diagnosed with MIS-C in Rhode Island. This brings our case total to 7 in Rhode Island across the entire pandemic response. The children more recently ranged in age from 4 to 12 years of age. The children were from communities throughout the entire state, And these were cases that were not geographically concentrated in one particular area in Rhode Island. While only 2 of these children tested positive for COVID-19 using a PCR test, all of these children had serological evidence of COVID-19, meaning that we know all of these children had antibodies that reflected the fact that they have had COVID-19 in the past. This is not unexpected because with MIS-C, someone often develops symptoms after having COVID-19. There's some element to the immune response contributing to the MIS-C. However, thankfully, none of the children had long hospital stays at all. All were discharged from the hospital and all are doing well at home now. We've been in contact with the Centers for Disease Control and Prevention about these MIS-C cases. And while this was a large number of MIS-C cases to be identified in a relatively short window of time, we do know that they came a few weeks after we saw a significant spike in COVID-19 cases in Rhode Island at the beginning of December. This is similar to what's happened nationwide based on our discussions with the Centers for Disease Control and Prevention. As cases increase, the chances of developing some of the consequences of that, like MIS-C in children, can increase as well. This is a reminder for everyone, all young adults, adults, and seniors, the importance of taking the prevention measures, the 3 W's that we've been talking about to stop the spread of COVID-19, the invisible spread or the active spread. It means wearing your mask, watching your distance, and staying 6 feet away from others, while also washing your hands regularly. These are the core measures for prevention that we've been saying since early on in this response, and we continue to repeat them only because they work. While we still have a lot to learn about what exactly causes MIS-C, every indication is that limiting cases of COVID-19 so that we have fewer cases, less spread, also will mean that we will limit cases of MIS-C. And that's a primary focus that we want to keep in mind as we're going forward.